If they're ready, physically fit, it will be a shorter course, but it's got to run the whole course. Okay? Now, in the beginning, you might not have any issues with signs and symptoms. None. But usually what you're going to start seeing is a sudden onset of fever and chills. Okay? Number 2, they're going to start coughing. And it's going to start producing productive sputum. And it could be actually purulent. But think of it this way. The sputum colors of the rainbow that usually indicate pneumonia are yellow, green, and gray. You start seeing yellow sputum or green sputum, yeah, you're probably coming down with pneumonia. Now, with all this coughing, they're going to have pleuritic pain. They're going to have chest pain because they're coughing so hard. And this pleuritic pain can be moderate to severe. But like I said, we have to distinguish that chest pain, that it is pleuritic versus cardiac. Of course, when all this fluid is going into the alveoli, there's lack of gas exchange, right? So there's lack of O's going to the brain. So again, the earliest sign is confusion, agitation, maybe stupor. And if they start coughing hard enough, they can start breaking little blood vessels, and you start having bloody, blood-tinged sputum, not hemoptysis, but just blood-tinged sputum. And of course, because of the gas exchange issue, our body was going to want to compensate, so we start breathing faster. Chest x-ray is going to show consolidation. Okay? If you learn percussion, it's going to sound very dull and flat because there's gunk in there. We're going to have increased fermentus. We're going to have bronchial sounds, definite crackles. And the thing is, they're going to get, just from coughing and coughing and coughing, they're going to get exhausted. Now, when it comes to that chest pain and the coughing, you should teach your patient to splint their chest with a pillow or something. That will help with it. Okay? Splinting your chest, we do it with our heart patients. We always give them a heart pillow to hold their chest because they just have their chest cut open. But the thing is, you're going to have all these symptoms. Now, complications of pneumonia is number 1, pleurisy, where we have that pleural inflammation. We're going to have pleural effusions. Now, depending on the degree, if it's only a small pleural effusion, it will reabsorb itself within about 1 to 2 weeks. But it might lead possibly, if there's enough in there in the pleural effusion, that we're going to have to do a thoracentesis. We're going to have atelectasis, and it can be in more than one lobe. But again, we can clear it with coughing and deep breathing and incentive spirometry. If the infection gets bad enough, we could come up with a lung abscess or an empyema, which is purulent exudate that's accumulating in the lung. And then amazingly enough, it can migrate to the heart, and you can come down with pericarditis. So it's not something, pneumonia is not something to just sniff at. It's a problem. Now, diagnostically, what are we going to do? Of course, the first thing we want to get is that lovely chest x-ray. That tells us a lot of things. And you're going to see consolidation in one area. Okay? Again, you're going to want to get sputum cultures and gram stains because and that's because we need to find out what the affecting organism is. So once we get the sputums for gram stain and cultures, that's when we can start a broad spectrum antibiotic until we've got the organism identified and we know exactly what drug will kill it. Of course, we're going to look at their ABGs to see that we're having adequate gas exchange. And we're going to look at labs. We're going to look at our white blood cell count. We're going to look at our neutrophil count. We're going to be looking at labs. Now, what you're going to see, this is what you're going to see somebody that has pneumonia and what it did in 24 hours. And I mean 24 hours. I have acquired these little things. This was the original one day with pneumonia. This whole lobe is affected with pneumonia. This was 24 hours later. That's how fast. And this is what we call a whiteout. There's a little bit of black right there. That's about where it ends. Okay, so we're not oxygenating one whole lung practically. Collaboratively, what we need to do is, number one, once we start the antibiotics, they should start responding within 48 to 72 hours after initiation of the antibiotics. Problem with the antibiotics, they still have their problems other than the fact that we're running out of them. What if the person has a hypersensitivity to the antibiotic we have that is going to kill the organism? So we might have a hypersensitivity reaction. Because of the overuse of antibiotics and stuff, we can cause now supra-infections. And of course, your organism isn't stupid. It's alive. It says, well, no, I'll just change what I look at and so that antibiotic won't work on me. And so it mutates. All right? Of course, we're going to have them on oxygen therapy. If they're having very poor gas exchange and they're starting to be respiratory compromised, we will definitely have to have them on some kind of oxygen therapy. Okay? Antipyretics, because we want to keep the fever under control. And then the newest thing, and we do it in all the hospitals now, starting I think it is September or October, one of the two, I don't remember which. Every patient that is going to be discharged from the hospital is screened for flu vaccine and pneumococcal vaccine. Okay? And they are asked if they would like the vaccines before they leave. Now, of course, the influenza or flu vaccine is modified annually, so it's a different vaccine every year. So you got to take it annually. And when you come back to school in August, you're going to already be being asked to get your flu shots because the hospitals require it. But your flu shot is changed annually. Now this year they didn't quite get it right. Now we got the second flu moving around. So they didn't quite get it right. The pneumococcal vaccine is for people, it's for pneumonia, and it's usually for the elderly, it's for people who are institutionalized, people with respiratory disorders. But the good part about the pneumococcal vaccine, you only have to get it every 5 years. Now, nursing-wise, we've got to identify those patients that are at risk, okay? You know, if all of a sudden we have a patient that had a 99 saturation the other day and their lungs were clear and now all of a sudden their stats are down at like 95 and you're starting to hear goop in their lungs and stuff like that, you know, there's your person at risk. And we should be identifying our patients. If they, like I said, if they have altered level of consciousness or start showing confusion, we want to get them on their side. We don't want them flat. But remember, we still worry about skin breakdown. So we want to position them at least every 2 hours, not only for their skin breakdown, but number two, it helps mobilize the secretions. Okay? Head of the bed up if we're getting a feed, and if they do have swallowing issues, they do provide thickeners for liquids and stuff in the hospital. One thing you got to remember about the thickeners, they have to be shaken, not stirred. And they will thicken it up so hopefully it will go down the esophagus instead of going into the trachea. The other thing for you is don't over-medicate your patients. That's only putting them at higher risk also. I mean, if all they're doing is sleeping because I got so many drugs on board, we're not doing them any favors. Use medical asepsis. I mean, at Shands, our thing is, what is it? Wash in, wash out. And they have spies walking around the hospital making sure you do it. Even on the floors, they have spies walking around making sure you gel in, gel out. But the biggest thing you can do to protect yourself, your family, and your patient is good hand washing. How long do we wash our hands for? To the song Happy Birthday. And I mean, you go in between the fingers and up the wrist and everything else. You should be washing your hands a lot. I personally do not like the gel, so I'm a hand washer. If I use the gel, I immediately go and wash my hands. That's all there is to it, because it's sticky. Okay, I'm going to keep you alive for at least another hour and 10 minutes. Stay back, you guys. That stuff has killed 99.99% of our fellow germs. All right. Now, nutritionally, for the patient that has pneumonia, we want them to get at least 3 liters of fluid a day. Okay? At least 3 liters of fluid a day. It is going to loosen that secretion so we can get it out. All right? If they cannot drink that much fluid, we can start IV fluids with electrolytes. All right? If they can eat, number one, we want them to get at least 1,500 calories or more a day. Nutritional eating, that is. And because of all the coughing and the gas exchange issues, though, we want to give them small, frequent meals. We don't want them to sit down to a big, heavy meal. Especially if they're short of breath. They're not going to eat that much. Now, one of the things we will do is teach them how to do pursed lip breathing, okay? And what pursed lip breathing does is it prevents alveolar collapse and air trapping. And all it is where you're going to breathe in deeply via your nose, purse your lips like you're going to kiss somebody, and slowly exhale out. Okay? So it's going to be twice as long to exhale out as it is to inhale. And that helps keeps the alveoli from collapsing. Okay? So we teach them how to do pursed lip breathing. The other thing we do for these patients is chest physiotherapy. And it's indicated for those that have excessive secretions. And it includes percussion, vibration, and postural drainage. And it's all 3 of them, one and/or a combination. When we talk about chest physiotherapy or postural drainage, it's where we use gravity to assist in mobilizing the secretions, okay? So we kind of tip them on their head. All right? And what we're going to do is that either do percussion or vibration on them. And what we do is turn them side to side to their back, and we have them cough every time we turn their position. But we're using gravity to help get out the secretions. Now, the other thing we do is percussion, which is what we call cupping and clapping. Okay? And it's done, you put a towel over the area you're going to do it on. If you're going to do it, you want to do the whole lung. All right? And what you're going to do is cup your hands, and guess what? I have a volunteer sitting right here. Basically, all you do is cup your hands. I know it feels good. And what you want to do is do it all the way up and down the lung field. And that helps, if you've got thick enough secretions in there, it's helpful to pop them out of the alveoli so that you can cough it up. Okay? And usually we do this with a nebulizer treatment beforehand. Now we'll put them in postural drainage position and we'll cup and clap. Now, we don't want to do it over any major organs, sternum, spinal cord, anything like that. And it is definitely contradicted with anybody with hemoptysis, pulmonary emboli, or carcinoma, or if it induces bronchospasms. Because if they have a PE, all we're going to do is loosen that PE. But cupping and clapping is very, very effective. The other thing we can do is vibration. And this is where we tense our hands and vibrate. Okay, so as they're exhaling, we're basically bouncing on them. And we can do that, it'll help also loosen it. Nowadays, they have this wonderful machine that does it. And, oh, man, I've seen it done. I've seen it where we've had patients on ventilators that have had real bad pneumonia, and we're doing it every 2 hours. And we're running it up. Actually, that thing is so good. If you ever get tense, I used to have my respiratory therapist come to my office and give me a treatment because it felt so good. Okay, it's really, vibration is really nice. Okay, now usually we do chest physiotherapy 2 to 3 times a day. But like I said, I've seen it up to 1 to 2 hours when it's bad enough. Now, because we're going to be tipping them, okay, number one, you want to do it either an hour before they eat or at least 3 hours after they eat. Otherwise, we're going to cause them to aspirate. Okay, the other thing we have to think about is the patient. Based on the patient, they may not be able to get in the position. Okay? They might, somebody with spina bifida might not be able to lay flat on their back. All right, so you got to think about that also. But they say you should definitely use a treatment, either a nebulizer treatment, which respiratory therapy will do, or they should get their bronchodilator just prior to doing it. So, when it comes to nursing diagnosis, most of it's going to be related to breathing, right? Ineffective breathing patterns, especially if they're hyperventilating. Ineffective airway clearance. If you hear just junk down in somebody's lungs, that's telling you that they're not clearing their airway very well. Of course, we're going to have gas exchange problems because the alveoli are full of stuff, fluids and goop. Acute pain, and that's going to be from the pleuritic pain that they're suffering from all the coughing. Okay? Imbalanced nutrition, less than body requirements, and that's due to the fact that they're going to be, they're so busy coughing, who wants to eat? Who has time to eat? I'm too big to get it, And of course, because of the nutritional thing and the gas exchange thing, we're going to have activity intolerance because they're going to get short of breath. And then the next thing is, of course, knowledge deficit. What can they do when we get them better and they finally do go home? What can we do for them so that they don't get it again? All right? So, discharging, we want to tell them when they go home, still continue to drink a lot of fluids, okay? Hopefully they will be going home and with the knowledge of how to use their incentive spirometer, and you should tell them to keep doing that for a while until they start clearing up. Get plenty of rest, okay? Because they're probably exhausted. They probably haven't slept a whole lot through this whole course while it was going on. What signs and symptoms to look for that it's coming back? We need to encourage they get the vaccinations and the importance of the vaccination. We want to make sure they get nutritious diet, appropriate hygiene, managing, washing their hands a lot also, just like us nurses, and get some exercise. Okay? So then the question here is, what are you doing to save time? All right, take your 10 minutes. When we come back, it's off to the wonderful world of TV.
Already So hey, so you have your computer and it transcribes what they say? How well does that work?
It's in Google document.
Does it work?
Let me show you. Do you know about Google Document?
I don't know how to use any of that.
And then you have to go to your Google. Okay. You have your account, right? Gmail account. Okay. And then you need to sign in your Gmail account.
Okay.
Okay. When you sign in your Gmail account, you go to here. That is all the programs that Google has. Then you go more and you find documents.
Okay.
Okay? Then you open documents and it's gonna tell you what you have. You can create new documents. And then you need to go to tools. And right here is voice typing. Say something.
I hate typing. This is awesome.
Right here.
Yeah, I gotta click.
Okay.
I hate typing. I want you to type for me.
You're what?
Can I see
Yeah.
what she did?
It's not perfect, but
you can piece it together.
Helping you.
Is it? It's recording at the same time.
Is it?
Can you?
No. I'm recording for my iPhone because it's the first time. It's my first time using this today. I didn't know about this.
That's it. That's like the whole thing. Yeah, that's awesome. Alright. I'm gonna get the red one.
The most of the time you can see the brains, like, you know what she's talking about.
Right.
And it's going to help you. I'm going to see after that because no idea how this is working.
Yeah. Why is it randomly like capitalized? Like because it randomly capitalizes words. No idea.
No. But this is, you can hear your, what you can do is what I'm going to do with my another class because they have to be really close to them.
Yeah.
And they are always walking around. It's not going to work, I think. But what you can do is take your report and you can tell the computer what write. You can talk to your computer everything that you are listening, and you don't have to go. Do you understand what I'm saying?
Meaning I can hold it to my computer? Is that what you mean?
You what?
I can hold this to my computer after it's... That's a really good idea.
Yeah.
No, I definitely don't get any of the benefits to the stuff that's on there. I have no idea. I probably could be.
Yeah. Try.
Yeah, thank you. That's awesome.
Maybe somebody teach me yesterday. You should do this. I said, wow. This. And he says, you can do. If this is not working with your computer, you can listen and repeat with your voice. And it's going to write everything that you want.
So what I've been doing... So, I don't have it with me. But I'll use, just a regular thing. Maybe I have something. Alright, so I do this, right? So I'll write questions and then I'll write answers, right? So I can basically